Oh, welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and an aging population. So I want to welcome everybody to our show, and also remind you that today's show is sponsored by Senior Care Authority, a senior placement and elder care consulting organization that has a national network of professionally trained and experienced local advisors to assist families. They will work with you in determining the right path for you or your loved one and discuss various long-term care options, whether it is in-home care, assisted living, memory care, nursing care, or you just need an advocate. Get advice from a Senior Care Authority advisor for your loved one. For a free 30-minute consultation with an advisor in your area, contact Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. So I'm always excited about our guests because I learn so much with each of our guests. And so I'm going to introduce them. We have two. First, Neal Mallam and Neal, I should have asked you, did I pronounce your last name correctly?
Yes, sir, you did.
All right,
Thank
great.
you.
Great. So Neal Mallam, and he's the regional manager for the Medical Air Services Association, known as, I think, MASA, it's pronounced, a prepaid medical transportation solutions provider. He has been an EMT firefighter and airline pilot prior to joining the MASA team. We also have with us Jane Bryant, who is the Director of Operations for MASA Medical Transport Solutions, a division of MASA Global. Janet has been influential in spreading the word to baby boomers across the country concerning the potential gaps in their insurance coverage, whether through private insurance or Medicare, in regards to emergency medical transportation. So Neal and Janet, thank you so much for joining us on the Aging Boomers.
Thank you for having us.
Thank you for having us.
Yeah, great. So, you know, we actually, in the years I've been doing this, this is the first time having someone on the show talking about medical transportation, which seems to be a pretty big deal today. So tell us, tell us a little bit more about MASA, about the organization, and kind of the role it plays.
Okay, I'll be happy to do that. We are Medical Air Services Association, as you said. We are MASA Medical Transport Solutions, which we bring this all together under our big name, MASA Global. But we are the pioneer, the first in emergency medical transportation business. And what I'd first like to do is just explain what that is, because a lot of times that seems like a big word, emergency medical transportation. But we're talking about your ground ambulance. A lot of people don't realize that when you say, emergency medical transportation, that it could actually be just taking an ambulance. It's also your air ambulance, your helicopter, and then your fixed wing transport, which is your medical air jets that you see out there. But what MASA Medical Transport Solutions does is we go beyond someone's health care coverage to pay for those unexpected bills that may arise for emergency medical transportation.
So can you give us a just example of the types of things that you see each and every day, of the types of things that wouldn't be covered by someone's health insurance, or somebody's, if they go to the airport and or even ahead of time and buy travel insurance. I mean, what are the types of things that you don't see covered?
Well, what I think is really important to note is that MASA is the only company out there that covers someone at home or away from home. And that's so very important because you have so many, we call them snowbirds in Florida and California, and then we call them winter Texans in Texas, but they go from one place to another. In their home states, first of all, not very many people all will cover the ground ambulance, so they're covered there. I'll start there. There's been $716 billion cut to fund Obamacare Affordable Care Act through Medicare. And so how they're doing that to be able to take that large chunk from Medicare is on the top of that list is emergency medical transportation. So language has been changed. You can go to Medicare.gov or your senior site on the website, and you'll see now language that starts like this. Depending on the seriousness of your medical emergency or the seriousness of your condition, that will be what will warrant an ambulance or not. And so we've had situations, you asked for specific. I had a lady that had sepsis. She had arthritis condition. She was going into surgery. Her doctor suggested that she take an ambulance to the hospital right there in her hometown. She was denied coverage because they felt she could have gone by some other means. And actually in Medicare.gov, it will actually say whether you could have gone by a car, a taxi, or any other means. So that's the first thing that we're seeing, that you could be, it doesn't matter if you have Medicare or if you have an Advantage plan or if you have a supplement. If you do not meet this wording, you can be denied altogether. And that's just on ambulance coverage. When you start talking about air ambulance, so you're in a rural area or you need to be transported somewhere else, or you're in California or Dallas, Texas, or these areas where the traffic is so bad that you would be airlifted, that's a completely different story, and we're seeing more and more and more of those huge bills. That's around $45,000 right now on an average, and we're seeing more and more of those denied.
So fortunately everything was okay, but I had to take for myself an ambulance that took me kind of, in the Bay Area, from one part of the Bay Area to the other. And, obviously when you're in an emergency situation, you're not thinking about, am I covered, am I not covered? Maybe some people do, but you're more concerned about, taking care of the situation. Now, fortunately, and I don't know why, I didn't know this, but fortunately it was covered, but I was able to see how much that ambulance ride cost my insurance company. And I was, let's put it this way, it was in the five figures, okay? Mm-hmm. And so most people really probably don't think about, well, if I have to go into an ambulance, is my insurance going to cover me? Is that a challenge to get, until it's happened to you, and then you realize you're going to owe a lot of money? I guess educating people like we're doing right now is one of the ways, but talk to us just a little bit of, about that. What kind of costs could someone incur out of pocket?
Well, I can answer that myself because I have MASA, the plan, of course I do, and it's worked for me several times. I have a pre-existing condition from congenital heart defect, and so I've had to use it several times. But one time in particular, I had to use it in Tampa, Florida. I was 5 miles from Tampa General. I had a wreck. I was unconscious. I didn't even call the ambulance. Someone else did, and they picked me up and they take me these 5 miles. Mine was denied completely, and it was denied completely because it wasn't in network. And so we see a lot of that because there are no networks. First of all, on your ground ambulances, most of the time, those are controlled by the county. The county 911 service sets up a budget for their county, and part of that ambulance income is used to help fund that budget. So there is no network. So even though they took me to Tampa General that was in my network, I was denied because it was out of network, and I had a $2,770 ambulance bill. The second thing that you asked, though, is so somebody say they do take an ambulance, and they say, okay, the seriousness of your medical condition did warrant that ambulance. How, under Medicare rules, will they pay for it? Well, this is a little tricky language also, but they pay it based off usual and customary charges. So you could have an ambulance, they type in your zip code, and say you got a bill that was $2,000, just to say. And they say, well, for that particular zip code, we believe that it's $500. Well, what's going to happen is you say, well, I have Medicare. They're going to pay 80%. So are they going to pay 80% of the $500 or 80% of the $2,000? They're going to pay, in most cases, 80% of that $500. So you have these individuals that go out and pay large amounts of money for supplements, and they say, well, I have a supplement. It's a GAP program. That will pay for the rest. Are they going to pay the 20% of the 500 or the 20% of the 2,000? They're going to pay the 20% of the 500. So now you have a 500 total pay. You have what's called balance billing, and that customer is balance bill for that $1,500. That is the remainder of that bill. And when you are looking at ambulance, coverage, sometimes you can go, well, great, they pay 80%, but on a $50,000 bill, you're looking at a huge $10,000, $15,000 bill on top of that as your pay.
So how does your organization fit into this? I mean, in a sense, are you insurance for emergency medical transportation, or are you actually providing the transportation? I'm trying to understand.
That is a really good question, and I get asked that all across the country as we do seminars. No matter who calls 911, no matter which ambulance comes to get you, no matter which air ambulance you take, MASA is going to pay the bill. We're going to go beyond your health care coverage to pay that bill. For emergency medical transport, I want to make sure that I mention that, because there's also a thing called non-emergency transport, where someone will go to the doctor or chemo, or they're not well enough to go to the doctor. We don't provide coverage for that. We are strictly emergency medical transport. But to answer your question a little more, we do have an international division that there are planes there for that division. We do have, but for everywhere else across the country, no matter who you call, we're going to pay that. You ask about, are we an insurance company? In some states we are, because that state regulates that. In other states we are not. We are a membership organization. But each plan or application product that we sell, a portion of that money goes into a reserve fund to be able to fund all of these transports.
And, I know of, fortunately it hasn't happened to me, and hopefully it never will, but I know people who were traveling internationally, had an emergency, and had to have, an airlift, if that's the right term, and, even brought back to the U.S. And, I can't believe most people, certainly the far majority of the people, can't afford something like that. So does it cover that, or is it just certain countries, or what?
No, we are a worldwide organization, so anywhere that the U.S. government says we can fly, that's where we will go. However, if you want to go to Syria right now, you're on your own, because we're not going to go there, or Afghanistan.
Gotcha.
But it is it's a wonderful product, because not only that, I'm glad you brought that up, because it reminded me of something. A lot of people think that they can get the travel insurance or these different types of insurances, and they go on these cruises. And I've had individuals that have come to me and purchased MASA. One man in particular went on a cruise, and he was in Alaska and had a massive nosebleed and actually had a hemorrhage and had to get off the boat and go to the hospital. He thought he was covered to be able to get back home, and he was denied because they have claim forms to where you have to be approved to be able to use that service for him to get back home. So the boat left, and he was on his own to get back home. With MASA, we don't have claim forms. We don't have networks. We don't have limitations, or we don't have a limitation on the amount of money. So that, I think that's very important to bring up, because a lot of places you have to be medically underwritten just to be able to get the product, to sign up for it. With MASA, that's not the case. Once you are in with us, you're in with us forever, and you don't have to do a claim form to get back. You call one number, or if that medic or doctor makes a decision that you need this airlift or this ambulance, MASA pays for it.
So what could somebody be denied? In other words, denied to even be part of your group?
In the case of being denied, it's just what I said before. If someone takes it for an emergency reason, and that could be, in Medicare world, they may have an anxiety attack, and they're going to be denied because the seriousness did not warrant that ambulance. In our world, if they took an anxiety attack, they thought that was an emergency, pardon me, they went to the hospital, we're going to pay for that. But what we're not going to pay for is if somebody goes to their doctor or goes to chemo or goes... Right. They could have gone by some other means, but it was not an emergency. It was a non-emergency.
Yeah, I guess my question was more pre-existing. So if somebody historically I mean, you brought up your, situation, but let's just say somebody does have congestive heart failure, whatever, and they have a history of they've taken few ambulances rides in the past year. Could you deny somebody like that?
That is a great question. The way that we look at this is we looked back in the future or in the past, and we could have medically underwritten someone to have our product, or we could put a pre-existing clause in. We chose to put a pre-existing clause, and it goes like this. In the first 90 days, if you have to use our service, we're going to look back and see in the last 6 months if you had anything pre-existing that was used for that service. If you did, we're going to cover you on day 91. So in other words, with my heart, I wouldn't be denied and not ever be able to get the MASA product. I would be able to be with MASA on day 91 for the rest of my life for this condition. Now, does that mean we're not going to cover you to day 91? Absolutely not. If you go out and break your leg or have a car accident or have any other thing outside of that pre-existing condition, we are definitely going to cover. We are not going to ask for any medical records. The only time we're going to look into that is in the first 90 days. If you have something that happens to you that requires an emergency medical transport, we're going to look back 6 months and see if anything during those last 6 months was pre-existing.
Okay, so let's say, I'm somebody who's, I have Medicare, and I have the Medigap insurance. I have, you've probably done this enough to know, generally speaking, and I know this is very general, every situation is going to be different, but somebody who has Medicare and good Medigap coverage, what are the types of things that you deal with that they would usually be covered for, and what are the types of things they usually would not be covered for? Is that a fair question, or is that really putting you on the spot?
It's a really fair question, and just to give you a little bit about my background, I am a licensed insurance agent and have been for quite some time, so I do know my Medicare inside out. Because I have to be, with my continuing education. But that is a very fair question. And what I like to remind people, and I've had that question quite often, is that it's not really a matter if you have Medicare or if you have an Advantage plan or if you have a supplement to GAP plans. Because the very first thing, because of the $716 billion cut, and this is what we see more often than not, is whether you're approved or not. That's the very first thing. And if you are not approved, your supplement is not going to pay for it, and your Advantage plan is not going to pay for it, because they all look at Medicare to make that first initial judgment. Now, say once you are approved, what am I seeing? I'm seeing that they're going to go back to that usual and customary charge, and you're going to come back with a balanced bill most of the time. If you have an Advantage plan, the Advantage plans are the ones that get hit most often because those are Medicare's giving that money out to a company to take care of that person's medical needs. So we see more denials through the Medicare Advantage plans than we do the actual supplements, but it still can happen. So, it really doesn't matter which one you have. It's a matter of if you're going to even be approved or not in the very initial stages of them looking at that claim.
Got it. So, I do want to get into kind of the difference with the membership, and I know it's very state to state, but just another question as it relates, this is covering pretty much just transportation. But once, let's say you had to airlift somebody or you had to take them in an ambulance and take them to a hospital, once you get them there, then you're not covering any part of the hospital work. I mean, that's got to be their own insurance, I'm assuming. I guess I'm asking.
Yes, that is correct. This is just for the emergency medical transportation. But one good thing to note is we have 13 different benefits. And say they're traveling out of town. Maybe they're coming from up north down to their summer home, down to their winter place, and they have an emergency. Well, we're going to either give them the option to stay at that hospital, and then when they're well, we'll fly them back home, or we'll fly them to a hospital near their family and also the person that's traveling with them so that they can recover around their loved ones. We're also going to hire a driver to take their RV, their boat, their car all back to their home. So there's many, many different things that we go along with this. So we also do a transportation to a specialist. Say they have something going on that they need to have checked out. Well, that's in my case. The reason I travel all over this country is because I know if something happens to me, they're going to take me back to Tampa General to my specialist. I think that's huge because a lot of us have pre-existing conditions.
Sure. Yeah. No, it's a great service. So, you know, people could be listening to this podcast today as we're, you know, once we release it, and people could be listening to this podcast 2-3 years from now because of the internet. So I don't want to pin you down on costs because those costs could change, but give us an idea of just how this works generally from a pricing standpoint.
Well, I can just tell you what we like to say, for as little as 80 cents a day, and that's for one person, you can be covered. So it's very inexpensive. We have different levels. You know, we have some people that choose that they want to be covered for life and pay one plan and they never ever have to pay again. And that fits into their budget. But I always say, and you ask all of the people that are around me, get in where you can. Because to pay something as low as, you know, $39 for a family a month, and it's going to cover a $10,000, $50,000, $100,000 bill for you. And what insurance are we going to use more than any other as we get older? We're going to use our health insurance. And to me, it makes perfect sense just because I've used it so much, and so have my family members and the stories that I hear every day.
Mm-hmm. So some states look at you as an insurance, so obviously if there was some disaster somewhere and you had a lot of people in that area that's covered by you, that obviously could get pretty expensive for you. All right, so there are people kind of I guess give our listeners some feeling of confidence that they'll always be covered. Maybe always is a tough term, but tell us how that works.
Well, and that's a perfect question because everyone wants to make sure that they're going to be covered. First of all, we've been in business 42 years. We are the pioneer in this industry. But on top of that, we do have actuaries that look at us just like an insurance company. And we do have, you know, trends of how this is going for our claims to be paid out. We have millions of members in many different divisions. Not everyone uses the plan at the same time. But it works just like an insurance company as there's reserves set up for all of these different events that you say would take place, and that's how we've been able to stay in business for 42 years. I'd like to challenge your audience to go and Google us. You won't find one bad thing about MASA except for how we've been able to help people on the internet, and I'm very proud to work for a company like that. Great.
So, you know, Neal, I know that maybe you get involved more in the membership plans for consumers and for businesses. Give us kind of an overview of that.
Yeah, I just want to recap again on one thing that Janet did say going into it. She said how proud, you know, she is, and that goes without saying. I mean, any company that goes as far as to, she mentioned some of the benefits, you know, to bring your car back. You know, we get a bonded driver, we bring your car back, and we go as far as willing to fill the thing up and even transport your pets. I mean, it goes without saying, you know, you won't find a bad review on us. But, I mean, to answer your question, yes, sir, I am more on the what we call a B2B, which is known as business to business. So my position or my role, I guess you can say, is you know, acquiring new business, you know, networking and giving the individual, giving the employee that business rate, providing, like I said, they stay employed, you know, under that current business. It's very special, you know, when I go and meet with, you know, the decision maker, whether it's the manager or the owner, that you can kind of have a heart to heart with the individual and talk about, you know, taking care of your employees, and it kind of, you know, it kind of hits home to the owner about, you know, how much, you know, how they have to take care of their employees, because the company is only good as your employees, and how you got to nurture those employees, and how you keep those employees, and how you and you keep those employees happy, and it sometimes comes from bonuses, incentives, benefits, and something like this, and I'll say it at as little as $4.50 per pay period, under $10 a month. This is coverage that keeps you and your family safe in the event of a medical emergency, obviously being transported. But that benefit, it's phenomenal. It's such a comfort, or a peace of mind membership, as we call it, because I have been on the EMT intermediate side, or the first responder side, so I have seen from my own personal experiences. I have seen a family of 4 in a van being transported to 4 different trauma centers, and I couldn't even tell you, the bill that would come with that, and we always talk about the golden hour of transport. The golden hour of transport is the hour within that's most critical, from the minute of occurrence to the time that they get to the whatever facility they need to get to, where their success rate is greater. So think about when somebody is in a rural area, and I reach out to a lot of companies that are in rural areas, and by the time, let's say, a helicopter is dispatched, to the time it gets out there, you've eaten up 20 minutes of that golden hour. So, whatever advanced care that they're giving them going back to whatever medical facility, there's another 20 minutes. So, you're eating up that hour of this essential coverage. And that's why I stress anybody in these rural communities, you have to get this. You have to. It's so important. And I think a lot of us walk around today, especially employees, just anybody for that matter, walk around today with just a false sense of security, thinking, and I think Janet touched on this earlier, thinking that we are all covered. Oh, I got this supplemental coverage, or what? It's strictly not the case at all. I think that it's our job. Look, this thing sells itself. It's our jobs, just as whatever role we have in this company, is just to educate. And once we educate, we have to educate through what we're doing right now, through news segments, through radio, through other means of advertisement. But we use numbers. We use a lot of statistics, because numbers don't lie. It's 8 million people in the Metroplex. 50% of those people within the Metroplex are going to be transported somehow in the next few years to it's one of the nearest medical facilities. So that's flipping a coin, heads or tails, and I would rather take my chances of covering my family, at least, with this coverage that, like I said, providing you are with the business, it's as little as $4.50 per pay period. Yeah. And that is, to me, that goes a long way, and that's me taking care of my family. That's how I feel about it. And I hope that answered your question.
Oh, absolutely. That was great. That was great. So we only have really just a couple minutes left. So either one of you, if you could certainly share with our listeners how they could learn more about MASA and your services, any contact information you'd like to share, and also just anything else that you think I missed that you feel is important to share with our listeners. So I'll let you take it away.
Okay, thank you so much. I think we shared a lot with your listeners and got out a lot of good information. But to get more information, you can go to www.masamts.com. So it's www.masamts.com. On there you'll find all kinds of information, but also to get in touch with us, you can call 888-441-0975. We have a packet that we can send out to you that gives you brochures and statistics and information on Medicare. And so if you want to call 888-441-0975 to be able to get this, we would love for you to do that. I will let you know that if anyone is interested in purchasing this product, please call the number, because you can purchase it online But by us doing this podcast, we're going to give a discount for anyone that's looking to purchase, so we'll be able to give you that without you having to pay more on our website.
Great. Well, thank you for that. Appreciate it.
You're
welcome. Neal Mallam, Janet Bryant, thank you so much for joining us with MASA Medical Transport Solutions. You could go check them out, www.masamts.com. So thank you both for joining us. Really appreciate it.
Thank you so much.
Yeah, thank you. And I want to thank everybody out there for listening to us as well. For those of you that don't already know, you can certainly share with listeners or friends how to get to our podcast. You can do so you could go to iTunes, iHeartRadio. Certainly many of you just go to our free app. So you could just, on your iPhone or Android phone, just type in The Aging Boomers, and you keep up to date on all of our shows. So again, thank you so much for joining us on The Aging Boomers. Be safe out there, and we'll talk to y'all soon.